Hi everybody, welcome to your spinal care class. I really like teaching this class because it gives me an opportunity to talk about something that's really important, and that's your spine. You think about what you use your spine for. You need it to get up in the morning, you need it to have breakfast, to get ready for the day, to get in the car, to get out of the car, to go exercise, to go do the things you love. Even breathing is hard if your spine isn't working and moving well. Now, the goals of this class are not only to teach you about your spine, but it's also to teach you about how to get the most out of your care. There's a lot of value for you here in this class. So pay close attention. Think of any questions that you have when you come in for your next appointment, and then we can go into more detail at that time. Now, I like to start the class by asking, what is chiropractic care? What does it mean to go see a chiropractor, or what does the chiropractor do? Now, I usually answer that question when I'm asked it by saying it's hands-on care. It's work we do with our hands. We don't use medication, surgery, injections. It's all what we do in the office and what you do at home. Now, the other question I like to ask is, what's the definition of health, or what is health? Now, we think we have a good understanding of what it is, but if you tried to write it down, it might be hard to really put it into words. Now, most patients, when I ask them this question, their usual response, or the ones I hear the most often, are, health is not having pain, or health is not feeling sick. Maybe health is being able to move well. And those are all great answers. I think the answer that I like to use the most, because it's very easy and very simple, is health is 100% of your body working at 100%. Everything is working as well as it can. And that's it. It's very simple. Now, the reason that I talk about it or define it that way, and not just it's the absence of pain or absence of hurting, is health has a lot of elements that aren't always seen or felt. And what I mean by that is, if we take two examples that are really extreme for health, like cardiovascular disease or heart disease, you can have someone who feels great, is able to exercise, everything's fine, and then they have a massive heart attack. Now, was that person healthy before the heart attack? Maybe they felt good. Maybe all their markers were really good when they had blood tests, but they weren't really healthy if there was something happening that was going to make them sick. The same thing could be said of many other diseases, including cancer, where the very early stages of cancer, where you can't even pick it up on a blood test or scans, you wouldn't say that that person is healthy because they do have something wrong. Now, I think that's important to understand because health is a moving target. It's not something you work on and then you're there and then you're healthy and then forever you're fine. It's something you have to keep working at. It's really a moving target, and it takes work from you and everyone that you work with, including all of your doctors and including us here in this office. Now, there's a couple things about the normal response to care, or what the average patient has, that I think is important for everyone to understand. Most people come in to our office because they're hurting. And sometimes, after the first one or two visits, people feel worse. Most of the time, that's because their bodies aren't used to being treated or worked on, or everything's really sensitive. And it takes some time to get your body to work and move better and get that sensitivity down. Usually the increased pain stops after the first one or two visits. Now, the other thing that we often hear patients talk about at the start of care is that after their first one or two visits, they feel great. They feel awesome. They go home, they're not really hurting. They wake up the next day and their pain just comes right back. It's almost like they're starting over again. Why does that happen? Most of the time, your body needs a chance to adjust, to change, to adapt to moving better. That can take time. Usually there's a gradual, steady improvement with each visit. where that window where you feel good after care gets bigger and bigger and lasts longer and longer. That is the usual response. Another thing patients often talk about, or I have to talk with them about, is that care or symptoms like pain don't get better in a really linear way. They don't go from feeling bad over here to all the way up to good in a really straight line. It's usually starting bad, it gets better, it gets a little worse, better, worse, better, worse, better, worse, and so on. It's usually the average improvement that we're looking at. A couple of bad days, some good days, don't matter as much as on average are people getting better. And that is the very typical normal response. Now, talking about the two types of care. For most patients who are treating for spine pain or sciatica and headaches, there's usually two options of care that we talk about. The first option is patch care, and the second option is fixed to as normal as possible care. Now, in patch care, the goal is really temporary pain relief. That's it. At the end of care, usually 4 to 6 weeks, depending on the condition, if you're not having pain, you're feeling pretty good, you're released from care. It's important to understand that most of the time, the problem causing your pain, which is usually joints not working and moving well, they're actually stuck and locked up, that problem, those stuck joints, is still there. They've just started to work and move a little better. Those joints have just started to move better than they were, but they haven't gotten to a point where they'll stay there. Which means that at some point your pain will come back because your problem is still there. And it could be weeks or months. When it comes back, you call the office, there's no need to panic, we know what's going on, and you start over. Now, the other option of care that we've talked about is fixed to as near normal as possible care. The goal of fixed to as near normal as possible is to address the underlying problem, that stuck and locked area of your spine, those joints that just won't move or work well. The goal is to get them working and moving so that you can bend forwards or backwards without stressing the discs and ligaments and nerves and causing pain. The better that your joints are working and moving, the more likely they are to stay working and moving. If they're just starting to work sort of well, the tendency is for them to kind of deteriorate and stop working well. Those are the two options of care. The most important thing to remember is that when it comes to fixed to as near normal as possible, we're measuring how well you work and move when you come in for your initial exam. We're trying to see how much you're actually moving, how close to normal. And when we do the re-exam later on in care, that's how we know how much better your problem is, the stuck area in your spine, the stuck joints that don't move. That's how we know about your progress. The problem is those stuck areas. Your pain is a different thing. So what I'd like to talk about now is the frequency of care. Most treatment plans either patch or fix to as near normal as possible. The 3 times a week, the 3 visits per week is really, really important. If you have to miss an appointment because there's an emergency, you must try and make that visit up that same week. And if you can't, try to make that visit up the following week so you would come in 4 times. Now, why is that so important? If you've ever learned to play an instrument or learned a new language, developed a new skill, or started to work out and tried a different way of training, you know that working out daily, consistently, gives you so much better results. You learn so much faster, so much more easily than people who are just doing it kind of here and there, once a week. It's the same thing. Your body has gotten used to working and moving in a certain way, and at this point, that way is not healthy. Getting your body to relearn how to move with more mobility, where the joints aren't stuck anymore, but they're actually working and moving better, that takes time. It takes repetition. So if you can't make that consistent appointment, or you can't follow through with those 3 times a week, what's going to happen is you'll lose momentum. Instead of increasing like we talked about, getting better, you'll start to kind of plateau and get frustrated. And none of us want to see that. Now, the next part of the class, I'm just going to talk a bit about the spine itself. All right, so here's a model of the spine. All right, so this is about a man, this is a male, this is about 6 feet tall. All right, so here's the back, here's the side, here's the front. Now, if you look at the side here, you can see these little yellow things poking out. These little rubbery yellow things here. Now, those are the nerves. They come right out of the spine itself. Your brain starts up here. It sends nerves down and out the spine like branches coming out of a tree. There's nothing that happens in your body that isn't controlled by your brain sending signals out through the nerves, out to your body, telling it what to do. It's so important that your body built this suit of armor around it, this set of bone, to just protect your nervous system. That's how important it is. Now, if you look between the bones here, you see these gel pads. These are the discs. These discs help you bend and move. Now, I might ask you, how do these discs stay healthy? How do they get a good blood supply? Is it like everything else where there's big arteries pumping blood in? Actually, no. These have little tiny arteries and blood vessels in the bottom of the bone that feed into the discs themselves. The only way you get good blood supply is by you squishing and squashing them as you move around and as you bend during the day. Now, if they don't get a good blood supply, they start to break down and become unhealthy. They start to lose their height because they lose water. The edges of the disc start to get cracked and they don't give or bend well, kind of like tires that are out in the sun too long. They just get these kind of cracks along the edge. So it's really important that your spine be able to move and bend the way it's supposed to. I want you to think about, when you think about the way the discs get to pull blood through the bone, I want you to think about a dried out sponge that you have maybe in your sink. You grab it, you put it onto some water, and it maybe starts to get some water in it, but as soon as you squeeze it, as soon as you pump it, it just fills with water right away. That's the same thing that happens here. Everything needs proper nutrition and blood supply. Now, if you were to think about what would happen if I was to say, take these two bones here, and I was to stop them from moving maybe 50% of what they're supposed to for a week, a month, and then they don't bend. Your spine doesn't move as well as it should in that area. Do you think that would start to affect the disc, the health of your spine, and then maybe start to affect the structures around it? If you look down here, there's a little model of a herniated disc here. So here's the disc, comes around, there's this red thing right here. And that's what happens, what they used to call a slip disc, but that's a herniated disc. And if you look right next to it, this little yellow thing right here, right there, that's a nerve. You see how that sits right on that? That feels, your body thinks that's like battery acid. It just, the herniated disc hurts so badly. I've never heard anyone give me a word in any single one language that they think adequately describes how bad that feels. Because it's not just burning, tingling, stabbing, it's just a terrible pain. No one should ever really have to deal with that. It's super important that all the joints and all the disc spaces and everything in your spine work and move really well. Like we talked about, for the health of your disc alone, it needs to happen every day where you're working and moving and bending, which is why we often say that moving is more important and better for you than sitting still and resting. And that is almost always the case. So if you're in doubt when you're hurting, moving is generally better. Now, the last thing I want to talk about today is what we're trying to change each time you come in. Each time you come in for a visit and we work on your spine and you're getting adjusted or treated or having ART or whatever we're doing, what's happening? So think about this is a spine, okay? These set of beads. Like each one of these beads is a different bone in your spine as we go down. Just like on that model I was showing you. In a normal healthy spine, each time you bend and move, each one of the joints and bones bends and helps with movement. They all do about the same amount of work. They all bend pretty well, all right? It's pretty even. Now, in areas where the joints in your spine are stuck and they don't work and move the way they're supposed to, they don't help when you bend and when you move. Now, that's represented here in this model with these red beads. So these are the areas where things don't bend and move the way they're supposed to. So when you go to use your spine, they don't help. They are not moving very much at all. If you look directly above and below, you can see that those areas have to move more to make the same amount of motion you normally have, meaning they get stressed a lot more than they should. They have to do more work than they're supposed to. Over time, this creates irritation of everything around it, like your discs, the nerves, the joints and muscles, and you end up in pain. That's why addressing your pain doesn't really solve these areas that are stuck. The only way to address that is by getting more motion back into those stuck and locked joints. So that's why each time you come in, each time you're treated, we try to get more motion in those joints, just a little bit at a time, encouraging it to move better and better, so eventually it stops bending like this and starts bending more like that again. So you get more healthy movement. I'd like to thank everybody for watching the class, for taking the time to listen. Please, if you have questions, come in, ask me on your next appointment, and I'm going to ask you some questions about the class. Thank you very much.